All right, well, good morning, everyone. It is September 20th, 9:02 a.m., and we're getting closer and closer to the busiest time of year. And I do want to thank everyone for being on the call today. We are having a few technical issues with this system. It's not allowing me to share my screen as much anymore, and it seems to be crashing. So I'm not sure what we're going to be doing in the future here, but we may change locations for the webinar. We might be looking into a new system, so just hang tight on that. You'll definitely get noticed by email and text message if we do move over systems, because it's going to be really hard for me to show you what I want to show you like we've been doing in the past. So I will be looking into how to go about future phone calls, and that way I can keep you guys abreast of what's happening out there in the world. So, but with that, today, why we're here, other than to make a living, we're here to improve the lives of our community with affordable health care. So thank you very much for going out there and doing that for the community, and it's a great way to earn a living. So as we normally start, we start with training, but I do have a special thing that happened over last week. We got a text message from one of our provider groups, and they were very impressed with one of our agents, Miss Teena Richardson, and Teena's done a phenomenal job taking care of the doctor group, and this is why she's been able to get in and work these doctors and get leads and get events and get opportunities. So I wanted to read the text message that Nick got, because Nick is helping us with the provider groups. So here's the text message. Hello, Nick. My name is Vonzella Randolph. I had an event this morning and I missed your introduction. I want to share with you. I've been working with Teena Richardson for almost a year, a phenomenal broker. Our center director is impressed how she will go the extra mile to assure that all of the members have a tour as well as a brief hello from the doctors. I can't tell you enough what a difference that makes. Thank you. Have a fantastic day. Great job, Teena. This is exactly what everyone should be doing if you're working with providers. What I really like about this is obviously the Miss Vonzella is very impressed and is working tight with Teena, wanted to reach out and share what a great job she was doing. But there's a relationship there, right? There's also, you can see there's a relationship with the center director. It seems like Teena's building a relationship with the provider as well, the doctors themselves. And so this just goes to show you, this isn't something that happened overnight. And you can see that she's been working with Teena for almost a year. So, when talking with some of the agents out there, I know that you guys are very anxious to work with doctors, but you got to lay the framework, you got to lay the foundation. And it looks like Teena's been doing that, and now she's reaping the benefits from that relationship. And so that's just a great thing. A couple other things I wanted to point out with this text message is that it looks like Teena is going the extra mile by taking the members to the doctor's office or meeting them there and giving them a tour or being part of the tour at the doctor's office when they first get set up and enrolled, as well as taking the time, and I know the doctors are super busy, but taking the time to try to connect the doctor and get a hello from the doctor to the member. I can't tell you how amazing that is, because that interaction, just a, hey, I'm the doctor, so nice to meet you, what's your name, great, look forward to having you as a patient, so sorry I can't spend more time, and off they go. But that little interaction can mean a significant amount of success for you, because that member now feels confident that they like the doctor, they've been introduced, they feel good about it. So there goes your buyer's remorse. So that's done. Then the member goes home, Teena's client goes home, and maybe talks to the spouse or the brother or the neighbor or the friend and say, oh, I can't believe this. I got hooked up with a new health plan, and I talked to the doctor, and they seem great. And then that person's saying, well, how do I get the same thing? And that's where referrals come from, right? So I just thought that this text message was just absolutely amazing, because there's so many great things that Vonzella had mentioned in here that we preach and preach and preach, And I'm so glad that Teena's having success with that. So awesome job, Teena. Congratulations. Continue that going. I know you're working with a few other groups, but I hope this inspires the rest of the team to go out there, lay that framework, and then continue to build on that relationship. And take it from Teena. You know, she's going that extra mile. You know, offer a tour for the doctor's office. Kind of integrates you with that doctor. And then, you know, if you can, try to connect that doctor with the member as soon as possible, even if it's by phone, or if you want to say, hey, you want to meet me up there, I'll introduce you to the doctor. Those types of things reduce buyer's remorse, especially when you're enrolling them in a plan that doesn't necessarily have their doctor. You want to ensure that that doctor-client relationship is started and is working well right out of the gate. Otherwise, that could be a big issue with disenrollments, especially after open enrollment in January, where you're going to get chargebacks, and we don't want that, right? So fantastic job, Teena. Amazing. All right. So let's jump into the training calendar because it is getting quite busy now. Lots of rollout sessions, lots of training here. I'm going to point out a few that I think you absolutely need to be on. But I'm going to go through a few. So this morning at 9, Humana and Care Plus are doing their 2022 benefit review. There's a ton of those, so don't feel bad if you miss it. They will continue throughout the year. At 10 o'clock this morning, Cigna's doing their virtual kickoff. That's national, so anywhere you are in the world, Cigna's there. And then Devoted is doing their coffee and chat session at 11 this morning. Moving on tomorrow, Tampa Team for Freedom. They are doing a training with Tom Iorato from Freedom and Optimum at 9 a.m. So if you're in that market, you can jump in there. Another kickoff for Cigna. This time it is local in Orlando at the Holiday Inn. That is tomorrow at 10 a.m. Tomorrow at 11, Devoted's doing an open training session. This one's virtual, so you can just jump on the call there at 11 tomorrow. However, here's one of the highlighted trainings for the week. If you're doing ACA business, if you're doing individual and family plan business for 2022, if you're going to be set up for Obamacare, the platform that we use is Health Sherpa. They are starting to roll out some training sessions for agents, and so this one is for tomorrow at 11. If you're good with Health Sherpa, if you feel confident, you've been using Health Sherpa for a while, fantastic. But if you're new to enrolling with IFP business, ACA business, then you want to jump on this call. It's at 11 tomorrow, and that's for Health Sherpa, and that's the platform that we use to enroll people in Obamacare. Okay. Also for tomorrow, 12:30, Cigna's doing another kickoff. Same thing that's happening earlier in that day. Another highlighted training here at 1 o'clock tomorrow. You've got Connecture, which is our enrollment software we call HPM Shop. So the back end, the company that runs that, they're doing a training on the impacts of medication adherence and how to use HPM Shop to improve star ratings for the health plans and increase medication adherence. And you'll learn a lot more about that. What is medication adherence? Medication adherence is basically the compliance of your members taking the right medications and also helping them reduce cost by either helping with quantity limits, moving them from generics to brand name drugs, whatever that looks like. There's lots of different ways that you can help your members reduce cost and help the system reduce cost. So, and you can do all that by using HPM Shop. So it's really, really great. That's tomorrow at 1 o'clock. Also tomorrow, United Healthcare is doing a kickoff for the Villages. So if you're in and around the Villages area, they will be at the Brownwell Hotel at 1:30. And then for tomorrow as well, at 2 o'clock, Cigna is going to train you on how to do social media. That's for all markets. All right. Wednesday, the 22nd, United Healthcare is doing their virtual rollout, and that is on Wednesday at 9 a.m. So if you need to get an update on the new products, benefits that United Healthcare will be having for 2022, jump on that call on Wednesday at 9 o'clock. And then also on Wednesday, the 22nd, understanding the Medicare Advantage sales process, I believe that's from Humana, and that is on Wednesday at noon. So if you're still a little woozy about that Medicare sales process, just know that That training's on Wednesday at noon. But we also have a pre-recorded sales process for MA that I did about a couple weeks ago. So that is recorded. So if you need help with that, check your emails. We sent it out, but we're happy to connect you on that as well. Moving on to Thursday. Thursday at 10 a.m., this is another highlighted training. If you're doing ACA, if you're doing individual and family plans, but you have clients that are just like, look, I'm not going to go in the marketplace. I think the off exchange is a little too expensive. We've got a new product called Paylik, and Paylik is Philadelphia life insurance company, but they have a product that's an off exchange product. It's an alternative to ACA business, and it's got crazy commissions on it, very, very lucrative. But really, truly, what this is going to do is going to help your clients, those clients that just don't fit that profile, that don't fit the gap. Maybe they make too much and they don't qualify for Medicaid, and maybe they just don't qualify enough for Obamacare. Okay, this is a good policy to fill that gap. Really, really great product here. That's at 10 o'clock on Thursday. We're also going to do another live training next week as well, so be on the lookout, email and text message, and we'll get you guys there. That's a live training in Orlando. All right. Also on Thursday at 11, Baycare's doing their product rollout. That's 11 on Thursday for 2022. At 11:30, Devoted's doing their coffee and chat session for the Jacksonville market. You can jump on that. Thursday at 2 o'clock, another highlighted training here. Pay attention, guys. If you're working with providers or want to work with providers, we've got Nick doing a training as well. Okay, so that's 2 o'clock on Thursday. You want to be like Teena? You got to know what you're doing. Join Nick at 2 o'clock on Thursday, and he'll share with you best practices on how to work with providers. This is a fantastic training. Very soon we are going to make this mandatory before we start assigning doctors, so please make sure you've been to a training with Nick. All right, Thursday, it's still real busy here. Thursday you've got another Understanding the Medicare Advantage sales process. That's Thursday at 3 o'clock. So if you missed the one from the previous day, you can jump on that one. WellCare's doing their 2022 rollout session on Thursday at 3 o'clock. That's virtual. You can jump on here and get on the Zoom meeting, and you'll be able to do that. And then a little bit of fun here. On Thursday at 4 o'clock, our provider partner, CenterWell, is doing a virtual kickoff session online. It's at 4 o'clock. They were going to do their traditional in-person thing, but it just is not going to work out. They're taking precautions, obviously. So Thursday at 4 o'clock, a little bit of fun if you want to jump on that. They're going to have parties and raffles and giveaways and all sorts of fun stuff, so you can definitely check that out. That's Thursday at 4 o'clock. And then moving on to Friday. Friday, just a couple more. Cigna's doing their virtual rollout session, another one there. That's at 10 o'clock. You can jump on that. Or at 11 o'clock, Devoted is doing another rollout session for 2022. Okay, I know, that's a lot of training. We don't expect you to be at every single training. But number one, I gave you some highlights, so make sure that you take advantage of those highlights. Really think that Paylik webinar is going to be good at 10 o'clock on Thursday. Check that out. And then also the provider training with Nick. So please, please, please make sure that you have this training calendar. Okay, this is a training calendar that's made available for you. Tom Ryan puts this thing together. It's a lot of work, so please make sure that you join one of these sessions. All the links, all the registrations are in that training session or training calendar. If you do not have the training calendar, please reach out to a team member and we'll get you connected. It goes on your phone, laptop, iPad, whatever you need. It's there for you. But training is important. Please make sure that you spend time doing that. Okay. So you're gearing up for AEP. You're doing your certifications. Now, a lot of you have not yet sent your certification notices to Jessica. Please send your certification notices to Jessica. So for instance, if you are now ready to sell with Bright Health, they should send you a notice, or you can download your certificate that you're completed. Or if you've finished your AHIP, go ahead and download that certificate. We need you to send those over to Jessica. Why? Because as we're updating our CRM system, as we're updating our database, we need to ensure that you're ready to sell for 2022. If we don't receive those notifications, it will not show that you're RTS with us, and we want to make sure that you're ready to sell. Okay, you will miss out on opportunities. We just want to make sure that you're ready to sell and you have your ducks in a row. Now, keep an eye on your emails, because we are going to get reports of agents that have not yet certified, or recertified for 2022. So please make sure that you're checking your emails on that. If you have any doubt that you are not ready to sell for 2022, you can always call the carrier. But remember, if you send it to Jessica, she'll do it for you. Okay, so she's going to make sure that your RTS, we keep a folder, we keep all your certifications in there. And so if there's ever an issue, a carrier reaches out to us first, we don't bother you. We say, nope, we've got the certificate right here. She's good to go. He's good to go. Just make sure that you're sending a copy of that. Now, I do understand some carriers don't have certifications specifically to download. Sometimes they just send you an email. That's fine. Forward the email over to Jessica and say, hey, look, I got this from Devoted, that I'm ready to sell. Just want to make sure that you're good with that. So please take the time to get organized and get those certifications over to Jessica, so that way we don't have any issues, getting you ready to go for AEP. All right. Also, just wanted to make sure that everyone knew that we are working on the HPM Shop, our quote and enroll tool for Medicare Advantage. For 2022, we're going to have some upgrades on that. So, as you know, we've added quite a few new carriers, one of them being Florida Blue. So because we've already closed out 2021 on our enrollment software, Florida Blue is not available to use on HPM Shop 2021, but it will be available on 2022, okay? What does that mean to you? Well, if you do have a member, if you're getting ready to sell and you're available to write for 2021, then you're going to have to use their enrollment software system until October 1 for January 1st effective. So 2022 HPM Shop will have additional carriers that you didn't have for 2021. Okay. Now, just to bring that up too as well, I want to make sure everyone is aware that when we get into open enrollment, we're going to have 2 HPM Shop profiles. Okay. So one for 2021 and another for 2022. Okay? Remember, the benefits are different in 21 than they are in 22. Why do you need both? Well, let's say Mrs. Jones calls you and says, hey, I just got my Medicare and I'm ready to go for November 1st. You can't use HPM Shop 22 to enroll them in a 2021 plan. You have to use HPM Shop 21. Okay? So I know it's a little dicey out there, but the good news is that the system will tell you that you messed up. So if you're trying to enroll somebody in 2022 using your 21, it's going to say you made a mistake, you got to log out and log into your other 22. So you're going to have 2 logins until November 30th, and then 21 will go away, and then you'll just have 22 for the rest of the year. So it's a little crazy. Just, best practice, guys, is create a bookmark on your laptop or whatever you're using, your iPad to do enrollments. Create a bookmark, mark it HPM Shop 2021, and mark it HPM Shop 2022. 2 different things, very simple process, but just pay attention, guys, okay? Pay attention. And, one of the things, and we talk about this in the sales process, is doing your needs analysis. So if you've watched your sales process, it's really important that you go through that process in the needs analysis, and you'll know what plan that you'll need to enroll them in, whether it's 21 or 22. You'll have a login for both. So that will be rolling out. Again, we're gearing up for that. I really, really, really sincerely appreciate everyone's patience with this. This software system is very complex. And just to give you an example of how complex it is, for each agent, you have several carriers. And each carrier needs to receive a notice that that agent is ready to sell and ready to use the system. So if you're contracted with 10 different plans, Jonathan has to send a spreadsheet over to Connecture, and then they get the ready to go for 10 different carriers. Now it makes it even more complex because let's say you're doing business in other states. So if you have a multiple state license, we've got to do those 10 carriers with every single state as well. So if you're in 3 states, it's actually 30 ready-to-sell notifications and hookups into the enrollment software system. So it's taken some time. Some things are out of our control. We do not have the ability to get approvals from the carriers or from CMS. That's up to them to give us the approvals. So sometimes it slows down a little bit. We're working through those issues. But we've got a great partner with Connecture. They've built our HPM Shop. We're really happy with what they've done for us on that. And so I appreciate your patience. Thank you for that. We definitely will have it ready for you for October 1. You won't be able to do enrollments on it, obviously, because you cannot take an enrollment until October 15th. But you can start to see the plans. You can start to do some shopping. You can start building out profiles for your members. You can save all that information so when October 1 or October 15 comes, you can go ahead and hit the enroll button and you're ready to go. So we'll have it ready. Don't panic. We're working really hard on this, okay? But I do want to thank you for your patience on that. All right, moving on to the Gold Key. I just want to remind everybody that the Gold Key is still available. That is our online server. We use Google Drive, so it basically has outlined all the plans in there. Tom has done a great job, grabbing resources and pulling them into the Gold Key. Take some time and explore that thing because it's got some great things in it. One thing that you're going to see in there is training videos, especially for HPM Shop. Okay, so as we're rolling out all these training videos and training resources, they will live in that Gold Key. So if you're like, okay, I'm not really understanding how to do this, you can go in there and there's some great resources in our Gold Key as well. It's going to have the sales videos. You're still required to show them the sales video. One thing I would say, there's several systems out there if you're doing remote enrollments. Obviously, we've got Zoom. I'm a fan of Google Meet. Just become an expert at that enrollment or that presentation software, how to share your screen, sharing information on how they can share their screen, and just connecting with your member to ensure that you can help them with the enrollment and the enrollment process. And the presentation, most importantly, you want to ensure that they can see what's going on and they feel good about it. And so just using a good software system is going to help you in open enrollment. So make sure that you're savvy on that. We do have a YouTube channel as well for some of those trainings. So if you prefer to go over to YouTube, you can subscribe there. Any videos that I pop out as far as training sessions, I've got a few on my deck that I'm going to be creating. You can go on our YouTube channel and we have a training thing there as well. If you can't find a training, just let us know. We'll shoot you over the link, and so that way you have it and you're good to go. All right, so that's all I have for today. We're finishing just a little bit early, so I'll give you 5 minutes of your life back here. I'm not going to open it up for questions right now because the system is acting real funky, and I know we've got some background noise this morning. If you have any questions, concerns, please shoot us an email, call us, text us. We're happy to help any way we can. And then as far as suggestions, if you have suggestions on what you'd like to hear on these Monday morning conference calls, please let me know. Again, I might be changing our system because I'm really not happy with what's going on with what we have right now. I'll keep you posted on what's happening with that. But for the meantime, we'll keep it straight. But I really do appreciate everyone's time this morning. Thank you for being on the call. Remember, these calls are pre-recorded, or we're recording it now, and then they're going to be available on the on our website. So you go to joinhpm.com, bottom corner, just go all the way down, and you'll see the latest phone call as soon as I upload it, which will be today's call, the one that you're on today. So thank you guys very much. We hope you have a fantastic week. Be safe out there, and go help people.